Discussing the audiometry testing. So as we all know, and as based on your practice, what you're doing before in your RLA is on how to do the hearing assessment by using the tuning fork, and of course the use of the otoscope. So it's okay naman that you have the idea on how to use the otoscope, because most of the time you'll be using that one in your hospital exposure and even on your clinical exposure if you will be doing a company nurse for the meantime. But then this procedure that I will be discussing are the tests that should be done as well by the nurses, both in the hospital setup and of course in the clinic. Okay, so let me first discuss you the audiometry testing. So when we say audiometry testing, it is non-invasive test which determines patient's ability to hear sound based on intensity and of course the tone. So as you can see from the picture, there is an audiogram there, meaning there is a graphical representation or the plotted points that you've done with your patient. So this one, the audiogram itself will be the one as your basis in giving the findings to the patient, and of course for the referral to your attendee, for your physician. And on the other side, it shows that there is a buzzer, or you need to press the button. Actually, it's the patient who will press the button if in case that he heard the sound or the tone from the audiometer. So what would be the materials in performing the audiometry testing? Of course, we have the audiometer, as you can see from the picture. This is the mechanical device which delivers sound waves of specific intensity and tone to the patient. So as you can see, there are two knobs there. So that two knobs is the one which you will manipulate in doing the audiometer testing. So how it is done? The examiner, which is the physician or you as the nurse, will physically examine the ear of the patient and determines if the audiometer is needed or not. Okay? So how are you going to do that? You will be just whispering the sounds both from the left and the right ears. So I will be showing you the video presentation of this one, that the examiner will be whispering on both ears. Then the instruction will be, you need to repeat every sounds that I've whispered to you. Okay? Or you can the examiner might also use of the ticking of a clock or the tuning fork in assessing for the hearing loss. Then if there would be problem, that's the time that they will be using the audiometry testing. But in some clinic, even though there is problem or not, for as long as the patient needs the hearing testing, like for example, the seaman, kailangan nila ng audiometry testing talaga para silang umakyat ng barko. So there's no need for you to wait for the problem. So we need to perform the audiometry testing, and the audiometry testing should be done of course by the nurses. So this one is done through the audio room, of course soundproof room. Patient is instructed to raise his hand or press button when she is able to hear the sound. So if in case that she'll be hearing the sound from the left, so she need to raise his hand, the left hand. And if it's with the right, it's on the right, she need to raise his right hand. Okay? Then ask patient of course to wear the headphone. Then turn the knob to ascending manner. So yun yung pero minsan hindi na natin ginagawa yung ascending manner kasi gusto nating hulihin kung nagsasabi ba ng totoo yung pasyente or not. So most of the time, minamanipulate natin yung knob for at least malaman natin kung mayroon ba talagang problem yung pasyente when it comes to his hearing. Okay? So ask the patient to wear headphone, turn the knob to ascending manner in each ear, and afterwards, after turning it on the required decibels and hertz on both ears, you need to plot the result of each ear on the audiogram. So for the left ear, there is a protocol in some clinic that for the left ear, I think you will need to use the black ink for the left ear, and for the right ear, you need to use right 10. Okay? So, it depends upon the protocol of the clinic. Then, plot the result of each ear. Then, inform the clinician of the result as well as the patient. So, the normal range would be, for the intensity of sounds, it is measured in decibels. And for the tones of sound, it is measured in hertz. So, normally, 250 to 8,000 hertz at 25 decibels, yun yung what we consider the normal range. So, what would be the degree of hearing loss? So, for normal limits, we have 0 to 25 decibels, 26 to 40, mild hearing loss, 41 to 55, moderate hearing loss, and 56 to 70, severe, moderately severe hearing loss, and 71 to 90 is the severe type of hearing loss, and 91 pataas. Increasing 91 is what we consider the profound hearing loss. So what would be the causes of impaired hearing loss? Of course, we have the infected earwax, chronic ear infection, ruptured eardrum, head injury, and of course the acoustic neuroma. So when we say neuroma, there is a tumor in the auditory canal, and that needs to be surgically removed. So we have the categories of the hearing loss. We have the type of hearing loss. Okay, and also we have the degree of hearing loss. That thing we've mentioned before, and of course the laterality of the hearing loss. So when we say laterality, is it on the left or is it on the right ear? Okay, now moving on with the type of hearing loss. So when we say hearing loss, we have two types. We have the conductive hearing loss and of course the sensory neural hearing loss. So when we say conductive hearing loss, there's a problem in the external or middle ear. So there is also difficulty lies in the conduction of sound to the cochlea. Then this can still be medically or surgically corrected. So when we say conductive hearing loss, again, this can be medically or surgically corrected. Now what about the sensory neural hearing loss? The problem in the inner ear or along the auditory nerve. The difficulty lies in the ability of the cochlea to sense the sound or the ability of the nerve to carry the signal to the brain. Okay, so this one has the problem in the inner ear. So this one is not medically correctable. Now moving on with the newborn hearing screening test naman. So the national goals for early hearing loss detection is 136. So when we say 136, screen before 1 month, diagnose hearing loss before 3 months, and start the intervention before 6 months. Okay? Kaya po naging 136. So, please bear in mind. So, 1 is the screening, 3 is for the diagnosing, and the 6 is for the intervention. So, as you can see from the picture, the baby is lying flat on the bed. So, the nurse is doing the newborn hearing screening test. Okay? So what would be the purpose of this one? So hearing screening procedure is done using the transient evoked emission, the AE screening test. So most of the hospitals were using it, but there are some high-tech hospitals there that is using the high-tech, of course, high-tech machine already. So like the St. Luke's. So it depends upon the hospital protocol actually. So as per hospital protocol, all infants shall undergo newborn hearing tests unless parents or legal guardian refuse. So in that case, if the parents or the legal guardian refuse, you need to secure consent. And of course, the waiver if she refused the said procedure. The policy would be attending physician and NICU nurses shall inform the parents about the benefits of newborn hearing tests. The newborn hearing test is done in NICU after 24 hours or after delivery or prior to discharge. Then for room and babies, hearing test will be done after 24 hours at night shift or prior to discharge. So why is it at night shift? Because most of the time, night is the what we considered the environment is very much silent, calm, because all the persons were on their proper area, and especially if you will be assigned in NICU and your neighbor is the OR, most of the time in the morning you will the OR personals were very much busy. So same thing, you with the patient will also be listening to the environment. If it's noisy in the outside environment, might as well, she can also hear that one. So might as well do the procedure during nighttime. Okay? Then, refusal waiver shall be signed by parents refusing the said hearing test. And for critically ill neonates, newborn hearing test shall be done once condition stabilizes. So most of the time, if it's critically ill neonates, we'll just wait for his discharge. So prior to his discharge, that's the best time that you can do the newborn hearing test. So what would be the materials for newborn hearing test? Of course, we have the echo screen, which is the hearing test device. Actually, this one is the machine that we're using in my previous hospital, no? So this one is the actual hearing test device, and this one has the air probe with different sizes, and you need also to prepare the tissue paper for wiping the probe, and of course the consent form that we've asked from the parent. So the procedure would be, prior to the procedure, you need to check the date and time of newborn birth. Then inform parents and explain procedure. Then you need to secure the consent. Then do the hand hygiene. Then prepare all the materials needed. Check the newborn's ID band and match this with his chart. And if in case naman that you'll be performing the newborn hearing test beside his mother, of course you need to do the counter checking of the ID band of his mother as well as the newborn. Then you need to secure from her the consent and ask her that you will be bringing the baby into a special room wherein he can easily hear the tone that is being produced from the audiometer. Then gently clean the baby's both ears prior to the procedure. Then connect ear probe to the probe socket of echo screen device. Then after that, you need to turn on the device. So if you're very much familiar in using your cell phone, this one is very much easy. So you will just turn on the device, then test probe prior to testing the patient. Then select an ear tape which fits the patient's ear canal. Okay? Then push ear tape onto the probe tip until it sits against the probe. Then insert the probe into the auditory canal to such an extent that it maintains a stable position by itself. So you need to check if the probe will fit the auditory canal of the patient. Then select the ear to be tested. Is it the right or the left ear? So from the main menu, if you have already placed the ear probe on the left ear, so you just select from the menu display on the machine the left ear. Okay, then press OK. Then the test progress is indicated on the display. You will check. You will see now the progress. If the procedure is doing good, then if not, there is a message that will prompt there. If there is a message like unstable message appears, check. You need to check for the probe to ensure for the proper fitness of the probe. Then, while checking for it, you need to cancel the test first. Then, press the right key, the stop, then cancel it. After checking for the probe, check the fitness on the auditory canal of the newborn. That's the time that you need to turn on the machine. Press again the left ear, then OK. Then wait for the completion of the test. After the completion of the test, the device will display pass or refer. Okay? And that thing, you need to print the result so that you can attach the result on the patient chart. Then calibration is automatically performed prior testing. What else? Clean probe and the tips. Transfer after this one is after the test. Clean probe and the tips. Transfer and save the results in the computer. So after doing the test, you save that one on the computer. And for refer results, print a copy of the test done. Then inform attending physician and the parents as well, and give necessary instruction. If the result is refer 1 or both ears, the baby will come back at NICU after a month for retest. Remember the goal that we have before, the 136. So considering that at 1 month, we need to screen the baby if he is suffering from hearing loss. So, that's the reason why he needs to return the baby after a month for retest. Actually, if you're much better if she can return the baby before 1 month, so that we can easily test if there is a hearing loss. But then, if the doctor instructed the mother to return the baby after a month, then we will follow what the pediatrician has been told us. Then do the proper documentation on the patient's chart. So that's it for today. So hope you have something that you've acquired, you get from my discussion for today. So please be informed that your final exam will be next week. So please be prepared on that. And we will also include this topic in your final examination. So thank you very much.